The human arm is a remarkable structure, engineered for complex movements and incredible dexterity. It allows us to perform a wide range of activities, from simple tasks like eating and writing to complex actions like playing musical instruments and engaging in sports. However, it can be susceptible to significant injuries, such as Monteggia fracture dislocations, which can severely impact its functionality. This type of injury involves a fracture of the ulna, one of the two long bones in the forearm, and a dislocation of the radial head, which is crucial for arm rotation. These injuries typically result from significant force impacting the arm, such as during a sports accident, a car crash, or a fall from a height. The shoulder girdle, vital for arm mobility, includes the coracoid process, a small but crucial bony projection that plays a key role in stabilizing the shoulder joint. Injuries to the coracoid process can be surprisingly debilitating, disrupting shoulder function and causing significant pain and mobility issues. Both Monteggia fractures and coracoid process injuries represent significant traumatic events that require immediate medical attention. They can be missed or misdiagnosed, leading to serious long-term complications if not properly treated. Understanding these injuries is crucial for accurate diagnosis and effective treatment, ensuring the best possible outcomes for patients. Our arms are essential for daily activities, and significant injuries can profoundly disrupt this harmony, making even simple tasks challenging. Seeking prompt medical attention is critical for recovery, as early intervention can prevent complications and promote better healing. Monteggia fractures often result from a fall onto an outstretched hand, commonly referred to as a fouche injury. This type of fall is quite frequent in both sports and everyday activities. The force from the fall travels up the arm, causing a fracture in the ulna and dislocating the radial head. This chain reaction is what makes Monteggia fractures particularly concerning. Direct blows to the upper forearm, such as those from accidents or physical altercations, can also result in these severe injuries. Coracoid process fractures often result from direct trauma to the shoulder or from forceful muscle contractions, which can occur during heavy lifting or sudden, intense movements. Recognizing symptoms like intense pain, swelling, and visible deformity is crucial for seeking timely medical assistance. These signs indicate a serious injury that needs immediate attention. Coracoid process injuries typically present with localized shoulder pain, tenderness, and difficulty in performing specific movements, making daily activities challenging. Swelling and bruising are common symptoms that may also be present, further indicating the severity of the injury. Early recognition and prompt treatment are key to achieving better outcomes and preventing long-term complications. Understanding the mechanisms and symptoms of these fractures aids in accurate diagnosis and effective treatment, ensuring a quicker and more complete recovery. Diagnosis begins with a detailed conversation about how the injury occurred. A thorough physical examination follows, looking for visible signs and assessing range of motion. For Monteggia fractures, X-rays of the entire forearm and elbow are essential. Clear X-ray views help identify the ulnar fracture and radial head dislocation. For coracoid process injuries, shoulder X-rays and specialized views are used. CT scans provide detailed bony anatomy if X-rays are inconclusive. Accurate and timely diagnosis is crucial for successful treatment. High-quality imaging studies and clinical examination form the cornerstone of diagnosis. Treatment for Monteggia fractures often requires surgical intervention, as these fractures involve both the ulna and the radial head. The goal is to restore normal anatomy using open reduction and internal fixation, or ORIF, which involves placing screws and plates to stabilize the bone. If the radial head remains unstable after initial surgery, additional procedures may be necessary to ensure proper alignment and function. Coracoid process fractures can be treated conservatively or surgically, depending on the degree of displacement and the patient's overall health. Non-displaced fractures are typically managed with immobilization and physical therapy to promote healing and restore function. Displaced fractures, however, often require surgical fixation to ensure proper healing and to prevent long-term complications. Complications from these injuries can include nerve injury, compartment syndrome, non-union, and chronic pain, which can significantly impact quality of life. Rehabilitation is crucial for recovery, focusing on restoring motion and strength through targeted exercises and therapy sessions. A structured physical therapy program is essential for optimizing outcomes and ensuring the best possible recovery. The duration of rehabilitation varies, often taking several months, and requires dedication and consistency from the patient. Implementing sensible measures can reduce the risk of injuries. Athletes should use appropriate protective gear and maintain good physical conditioning. Warm-up routines prepare muscles and joints for exertion. For older adults, fall prevention strategies are crucial. Proper falling techniques can offer some protection. Strengthening forearm and shoulder muscles provides ancillary support. Early and correct diagnosis is the cornerstone of successful treatment. Prompt medical attention is essential to avoid complications. Delaying evaluation can lead to a more difficult recovery process.